Hi, and welcome to the Revive, Thrive, and Optimize podcast. I'm Billy Weiss, compounding pharmacist and health and wellness expert. Today, I have a special co-host, Don Miller. How you doing this morning, Don?
I'm doing great.
Good. So if you didn't watch the episode that Don was on, go back and watch it. I'm not sure what number it was, but it was really good. He comes from physical therapy background and has treated everybody from the professional athletes to just the regular old people out here like us. So, Don, welcome.
Thank you. Also, not just physical therapy, but from strength and conditioning too.
Yep.
And since I've met you, I don't know how many, 10 years now?
Yep.
I've been into learning a lot more about health and wellness, which has been really a lot of fun.
Right. Yeah. I've had a ball learning from you too. And you've worked on me and Beth and the kids, so with different things.
Family
helped
plan.
us a lot. Family plan, yeah.
Well, you've worked on
my mom.
You've worked on my whole family too.
Yeah.
All my kids have been through your program.
Yep. Yep. That's awesome.
Yeah.
Yeah. Well, today, Don, we're going to talk about a very important subject for men, right? So last week, Janet and I talked about women and menopause. And today we're going to talk about men and what's called andropause, but I think producer Mike's going to call it menopause, right? So hopefully that'll get some people intrigued to watch and see what we're talking about.
Yeah, we don't hear about that as much as we do menopause.
No, but tell us a little bit about what you've noticed with other men and maybe even with yourself with this condition.
Well, I'll start with myself because it was kind of I went to my doctor and who's since retired and was a friend of mine and a former patient of mine. So I had a good relationship with him. And I was just like, man, I'm feeling tired, all the time. And I couldn't figure out what was wrong. And I saw something, a podcast or something about testosterone. This is before we even met.
Mm-hmm.
And I went in and I said, you think my testosterone might be low? I mean, I had to ask.
Right.
I didn't suggest it.
Right.
And he said, well, we can test it. And it was like 150. I mean, and I think Janet's testosterone was actually higher than mine, right? Which,
right.
When he said your testosterone is low, my first response is, no, it's not. My testosterone can't be low. And it really made a huge difference, even with the stuff that they gave me to try, which was, I think, Cypionate.
Yeah, the injection, testosterone.
Which I think is for intramuscular use in horses only, supposed to be.
I'm not positive on horses only, but
I'm kidding about the horses only, but I have seen that on the label before.
Right.
I used to be a power lifter and was kind of afraid of steroids and testosterone because I saw a lot of people do it.
Mm-hmm.
And, it kind of made me a little nervous. So I kind of stayed away from it and didn't want anything to do with it. But when they told me that I needed the testosterone and that he thought it might help, it did. It helped. I felt better. But the levels were, I guess he got me around 350 to 400, and that was acceptable. But I think I met you at that point and talked to you a little bit about it. And really felt like I needed even a little bit more. And I felt better when I was up around over 800.
Mm-hmm.
And, they thought that might be too high for somebody my age. And I'm like, well, I feel better when I'm at 800. What's the consequences of, using that?
Mm-hmm.
And they talked about, prostate and all the other stuff, which I've come to learn is not the case.
Correct.
And, thanks to, learning stuff from your program and talking with you, I realized that I don't want normal levels. I want optimal levels.
Right.
If you look around and you see what normal is nowadays, I mean, most of the people, they're pre-diabetic or, they're insulin resistant and have some kind of metabolic issues. And if that's normal, I don't want anything to do with it.
Yeah, you're right, Don. In America, we don't want to, and we talk about it all the time, right? Optimal.
Yeah.
Revive, thrive, and optimize, not normalize, because normal is sick. That's a really good point. And you said a couple other things that really triggered me to think. You talked about in the powerlifting world, you were a little bit scared of it because people may have misused it. We're talking about using testosterone not for powerlifting purposes, but for health and wellness purposes, for overall benefits. Now, it's going to make us stronger if we're using the adequate dose of testosterone, but we're not just going over these crazy levels, right? Trying to get people just to be big, ready to go on stage. We're doing things that are improving their heart health, their brain health, their bone health, their visceral fat, their,
Absolutely.
So subcutaneous fat, increase muscle, increase libido, increase sexual performance. I mean, just overall vim, vigor, and vitality, the 3 V's, right?
Yeah.
Improve.
Well, there's a big difference between optimizing, which is what we're talking about,
right,
and being on the low end, which is where I felt like I was, versus some of these guys that are bodybuilders or athletes that are doing it. They're doing crazy
mega doses.
Yeah. Which obviously isn't good either.
Right.
And that kind of scared me. And when my doctor was talking about all the other things, I wanted it to be as low as it needed to be so that I would feel good.
Right.
And that's not necessarily optimal either. Because I know that when I was hitting 750, 800, whatever, I felt much better than when I was down around 300.
Right.
So, I guess it's individualized too, but I do think that they're lowering. I think I noticed the normals from like LabCorp or for wherever I get my test. It was at one point, I think 1,200.
1,593.
And now it's down to what?
964.
Yeah, so that's the high end now, and it's reduced way down.
Well, and the low end's been reduced way down too. So we used to have a high end in the early 2000s of 1,593 for a man.
Right.
Was the high end on testosterone. This is total we're talking about. And now it's 964, excuse me, and some labs are going to 750. And that's because we're basing it on the average American, which is what you just talked about, how they're diabetic, insulin resistant, overweight, waiting to have a heart attack, stroke, blood clot, cancer, whatever. You also brought up a really important point on the, before I forget, we'll go back to the numbers, but on the prostate. That is something that we've heard over the years, that it can cause prostate issues, when actually it's very protective against prostate cancer to have optimal levels of testosterone. And that's what the studies show. So I think what happens, Don, a lot of times is when we look at, now there are studies out there that say, well, testosterone doesn't really do anything. Okay, it doesn't really help. But what you'll notice in all those studies, and there's dozens of them, all those studies used a little teeny bit of testosterone, and they would raise a man's level a very small amount. So somebody like you goes from 150 to 350. Well, of course it doesn't do anything because you're still extremely low.
Yeah.
Right? Now, normal today, though, goes down to 264, I believe it is, in a man. That is not normal for a man of any age. 264 is not going to be sufficient to make their dopamine work, to make their muscle work, to make their fat work efficiently. I mean, it's just not. They're pre-diabetic. Testosterone plays a huge role in that, or diabetic, or insulin resistant, or all the above, right?
Yeah.
More testosterone receptors in our heart, men and women, than anywhere else in the body. So it's really sad, but what happens is now if you go in and your number's 265 or 275, they go, well, you're normal. And you go, yeah, doc, but
I feel bad.
I feel terrible. I can't lose this belly fat.
Right.
I can't get, I come home from work and I don't want to do anything except go to sleep or sit on the couch. I just don't have that get up and go. And so it just, when we've made normal such a box to put people in, it's really sad.
Well, the thing that's kind of discouraging too is when you go in and you tell your doctor this, and I'm 62, 61.
Right.
And what's your age?
Yeah.
Well, no, it's not.
Right.
It's not my age, because I know now that my levels are more optimal.
Yes.
I feel different. I have more energy, and I see it in patients too. I had a lot of patients would come in, and guys, after, I learned a little bit through working with you, I'd have my patients would come in, and guys would be like complaining, some of you get to know them pretty well,
right.
Become friendly with your patients, and they talk to you about different things. And I can't tell you how many times I said, have you had your testosterone checked?
Right.
And I've had several patients that would go in, several friends that would get it done, and then they would get more optimal, and they would thank me because they felt so much better.
Yeah.
And I can't understand why it's missed so much.
Well, Don, that is something, and I've probably talked about this on a previous podcast, but I do get texts quite frequently of people, men and women, and a lot of times couples, that will just simply say thank you after they get their hormones back. they'll just text and say thank you.
Well, whether it's optimizing the male or the female, or ideally both,
right.
I do know that things are much more pleasant around our house when we're both optimal.
Yeah, absolutely.
And fun.
Well, yeah, absolutely. And you also, Don, you talk about something that's really, you triggered me to something that's really important is so far you and I have only talked about total testosterone.
Yeah.
Which is okay to measure, but it's really not what matters, right? What matters is free testosterone.
Mm-hmm.
Most people are not ever having that test even done.
No.
So maybe you have a total of 150 and your free is, 2.
Yeah.
We optimally, now this will be outside of LabCorp's numbers, okay, and Quest numbers, but we typically want the free for a man to be between 35 and 60. I would challenge you to find any man of any age today that's not using testosterone that is there.
Wow.
Because over the past 50 years, testosterone levels for men have dropped, and they're dropping year after year after year. And so we see that, you're 61, you said, I'm 57. Men our age, people our age, we'll call it 40 and over, have higher levels typically, whether they're supplementing without any use of testosterone.
Mm-hmm.
They're higher than the 20 and 30-year-olds of today.
Wow.
And that's why we've seen the numbers on the labs drop so much, because it is, quote, normal in society to see these numbers drop. And I think a lot of that is due to all the microplastics, right? The forever chemicals they're exposed to in utero before they're ever born. It's all the EMFs. It's all the atrazine.
It's constant.
It's just we're bombarded.
I mean,
right?
even something as simple, and I'm learning more and more about this. Like I used to do the K-cups.
Yeah.
Stop doing those. I've got metal ones that I load with my own coffee now. And when you go to Starbucks, if you get a Starbucks coffee, the plastics.
Yeah.
I mean, it's everywhere.
Well, it is. It's in the it's in all the containers, like the burger containers, like a Big Mac container, or if you go to Burger King or any of those places.
Fortunately, we don't go there.
No, we don't. Yeah, we don't go there. But my point is, a lot of people are.
Yeah.
And I can't remember. I had a guy who makes those kind of containers tell me that, and don't quote me on these numbers, but like the Whopper for Burger King, like that package had like 300 and some odd different endocrine disrupting chemicals, so mess up our hormone chemicals.
Yeah.
In just that one package. So you can imagine if it's in that one, it's in all of them. And that's what he was pointing out. And then you have the atrazine that we're spraying just millions and millions, if not billions of pounds a year, which actually will turn frogs and fish from male to female.
Wow.
So, I mean, people are just being overloaded. So we have, but here's the good news. Well, there's a good and bad to this, right? The bad is we're being overloaded. The other bad is most of the medical community doesn't get it, and they look at 264 and go, "Oh, well, you're normal," or you're at 150, and they say, "Well, we got you to 350." So it's sad that we can't get back to optimal numbers in a lot of cases.
Yeah.
The good news is, though, the antidote to all this is to try to minimize the exposure to this stuff as much as we can, and there's no getting away from it.
Right.
But the real antidote is to use bioidentical compounded micronized testosterone cream. And so we can put back what the body is missing, and then the man starts to perform and feel and think like he did before.
Well, you brought up a good point, because I think you may remember when I was telling you about it, my main concern at that point wasn't necessarily physical.
Mm-hmm.
It was the brain fog.
Right.
And I think that I noticed a big difference in that when my testosterone levels were more normal.
Yeah.
When I say normal, I mean optimal.
I understand what you mean.
Yeah.
Yeah. When you got them back to a level where it worked for your body.
Yeah.
And so, Don, that's a really important point too, because we know testosterone increases dopamine in the brain. We know the studies show that it helps with anxiety and depression. Mm-hmm. So all these things, when we start to just, hey, I can't think like I used to, I don't recall like I used to, it can absolutely be related to testosterone levels.
Sure.
So when you look at the studies, testosterone is a very, very effective antidepressant in men and women.
I would say, you know, my father, he always had like seemed to be a low level of depression.
Mm-hmm.
And I don't think they did anything for him with his testosterone. And I'm wondering, I think that because I know for myself, I feel it may have helped him.
Right.
And I really appreciate the fact that, you know, you've educated me on the importance of that and how to do it optimally and safely.
Right.
Because, you know, I had that in the back of my mind that it was dangerous and that it was going to cause prostate problems. And,
Right.
you know, but I do notice that my workouts are better. I recover faster. I have a lot of orthopedic issues from accidents and different things. And when I manage my testosterone with the bioidenticals, as well as the pillars that, you know, you recommend, I notice I recover faster and I don't hurt as much.
Yeah, absolutely.
Yeah.
I mean, recovery is one of the things that, you know, I'm working out with a lot of CrossFitters, right? And all these guys and ladies, once they get their hormones optimized and after they see what it does for one person in the CrossFit gym, they all want it, right?
Sure.
They all will talk about, man, I just don't get sore like I used to. I feel good the next morning when I used to would have been down for a day or so, you know, with soreness.
Right.
And so it does make a huge difference.
Well, you talk about CrossFit. I just want to, you know, being a strength and conditioning guy since 1987, you don't do CrossFit the way a lot of people do CrossFit.
That's true. That's
because, you know, that's that type of training and the intensity levels and the speed, you know, it can be kind of problematic,
right?
Especially for older people.
Yeah, yeah.
You know, so when you say CrossFit, you're doing it in a very responsible way.
I think so.
Right.
I mean, I'm programming all the workouts.
Right.
It's geared. Our CrossFit workouts are geared more for people who are, we'll call it over 40, which doesn't mean they're not CrossFit workouts, but yeah, they're not done like the CrossFit Games you might see on.
Yeah,
TV.
yeah.
We're
right.
not doing just ludicrous. We're not in that kind of shape either. I mean, we're not that kind of athlete. But yeah, we're trying to do it by building a lot of strength, but at the same time, keeping our what's called VO2 max, or our lung capacity, at maximum benefit.
Well, and also taking into consideration any orthopedic issues that may be present with each person, and when that's how you do it,
right?
And I have a lot of respect for that and appreciate that, but that's not how all CrossFit.
No.
I have a lot of patients,
right,
that have been CrossFit.
Right, I understand. You know, one of the things you talked about, Don, was how to use it correctly. And I think that one of the things we should talk about here is how the differences, some of the differences between the cream, which I think is far superior and people get better results, and the injections that you brought up right at the beginning, like the testosterone cypionate. So one of the things that we see, and the studies are very clear, that if you take a once weekly or even twice weekly injection,
you get that spike. Yeah,
you get a big spike, you get a big jump, and then you crash, and then you get a big jump and you crash. And so, you know, one of the disadvantages to the injections are that we don't want to do an intramuscular injection very often, I don't think, but that you're going to get peaks and valleys. And the beauty of using the right compounded cream, especially if we can get men to use it twice a day. Once a day is okay, but twice a day is better because the half-life of testosterone in a man is 12 hours. So if we put it on morning and night, and you look at the studies, the levels will be like this.
Well, I noticed.
So they stay steady.
I've been doing it once a day versus when I was doing the injections, I think it was once a week.
Right.
And I feel more level and
Correct.
more even.
Correct.
I hadn't thought about twice a day. It was hard enough to get my physician to order the cream and the amount that I wanted it.
Right.
And when I went back and asked him about increasing the dose, well, why? You're already at whatever it was,
right?
Maybe 450 at the time, and I thought it was a little low, right?
Right.
And he didn't want to increase the dosage. He said, "For your age, that's fine."
Yeah.
And I'm like, "No,
right?
It's not fine.
Right.
I know the difference between how I feel now and when it's over, 750, 800."
Yeah.
And I don't know how he. I don't think he liked that too much, but you know what? I don't care.
Right.
I mean, we have to be advocates.
You have to be the CEO of your own health.
Well, I mean, I want to treat myself as at least I would advocate for my patients.
Right.
So I have to do that for myself, and I've become more and more not aggressive, but assertive about it because it's my health.
It is, Don, and your doctor, unfortunately, is just not trained on your health. He's trained on drugs.
Well, it's the same thing with the insurance companies and pharmaceutical companies. In my business, unfortunately, I did a lot of things that I wasn't reimbursed for because my patient, and I know you do too.
Yeah.
Because my patients needed it. But when you're in a large company, profits a motive.
Right.
And insurances determine what, like, for example, the thing that I am best at, that I've studied the most, it's the most complicated, is reimbursed the least.
Right.
It makes no sense.
Right.
And I know that it's similar.
It is, Don. I talk about it with people all the time. I mean, if you're looking for the copay,
Yeah.
you're in trouble because they only pay for the things that really are inferior to what we're talking about or have side effects or don't work at all, right?
Yeah.
That's why you can't get a free testosterone unless typically you pay for it.
Well, and you have to ask.
You have to ask, number one, because they don't know to order it, correct. The medical community is not familiar with how to order it because nobody's ever told them. And then number two, the insurance is going to not want to pay for it, so it's something you're going to have to pay for. And then number three, they're not going to pay for the compounded medication, right? They're not going to pay for the compounded cream.
Yeah.
But if you want results, if you want to feel better, if you want to perform better, Don, this is something that I should have pointed out in the beginning. The studies are pretty clear. When you give an adequate dose of testosterone to a man or a woman, every single marker of health improves. Every single marker.
That's amazing.
Cholesterol can improve. Brain function improves. Body fat improves. Visceral fat improves. Subcutaneous fat improves. Muscle improves. Blood pressure improves. Insulin resistance. Diabetes improve. I mean, you go down the list and your heart function improves.
Well, and my wife would tell you that my attitude improves too.
Yeah, now, Don, you bring that up.
That's important.
It really is important
It
because
is.
I know a gentleman. I haven't asked him, so I'm not going to tell you his name. But he started using the bioidentical cream. He went to see Kim. He started using the bioidentical cream. And he said, I really notice it working out. He's a UPS guy,
Mm-hmm.
and he goes and works out in the evenings. And he said, I can really tell in my workouts that they're better. He never said anything about his mood or the way, he felt. But his family, his wife and his kids, he's got 2 kids that still live at home or that live at home. And they said he comes in, he's not grumpy anymore. He's not all ill with us, and it's something that a lot of people don't even realize, right? That they're like that. He doesn't still to this day think that anything's changed on that, but they noticed a significant difference because there was a time that his wife usually calls it in. She called it in, and Sue told her, said he doesn't have a refill, and she said, well, you make sure you get it because he's a completely different person when he has it. And so it really does change.
Janet said to me a couple of times, over the course of the past 10 years, she said, when was the last time you got your testosterone checked?
Yeah.
I'm like, okay, I must be being grouchy.
Yeah.
Well,
Don, I think it's important for us to end with if men don't have a provider who will order their free testosterone and get them to an optimal level of free testosterone, somewhere between 35 and 60 for most men is where they're really, really going to feel good.
Mm-hmm.
That total may be higher than what is, quote, normal. Actually, that total will be higher.
Well, we
than
hope
what is,
so.
Quote, normal.
Yeah.
Which we don't care because remember, it used to be $15.93. So they need to take action. They need to be assertive. They need to be the CEO. If their provider just absolutely won't do it, then they need to see a Kim Spain or somebody who understands it's trained in it and will do it. And the other thing that's really important that we need to hit on, I know we're out of time, but if you look at the studies, men are going to a lot of these, we'll call it testosterone clinics. As one doctor calls it, instead of whatever male, he calls it X-male clinic because they turn men to X-males. They take them down because they give them an inferior dose of testosterone, which oftentimes can make their testosterone actually lower than what they were making before.
Wow.
But they put them on
That's malpractice, isn't it?
Well, Don, it's standard of care.
Yeah,
That's what it is in America.
There you go.
they put them on what's called an AI, an aromatase inhibitor. And so what they're saying is that will block the conversion of testosterone to estradiol. Because the theory is estradiol is a woman's hormone. We don't want to run the estradiol up. This is an old bodybuilding world thing. Take high doses of testosterone or any dose of testosterone, block it with an aromatase inhibitor. Those drugs are shown to increase the risk of every disease there is. So if a man is on one of these AIs because he's afraid he'll get his estradiol level or estrogen levels, what they'll probably call it, too high, he really needs to reconsider the provider that he's using because they don't understand it. Because testosterone is really just a pre-hormone to estradiol and to DHT. And the benefits of testosterone actually come from estradiol and DHT.
Oh, wow.
So we do not want to block that.
Right.
It's very dangerous to block that. And that's why you'll see that a lot of bodybuilders, especially back years ago, you would see these strength guys, power lifters, bodybuilders,
Yeah.
you know, they'd die of a heart attack in their 40s and 50s or 60s. And that's because when you block estradiol through an AI, aromatase inhibitor, such as anastrozole,
Yeah.
you really start to increase the risk of heart disease. Estradiol is very protective of heart
wow.
and bones in both men and women. So I just want to point that out as a point of reference for people to really take control of their health. Call us if you need a consultation, but if you're on a testosterone and an AI, you really need to talk to somebody about it.
Well, it's amazing to me how little this is really talked about with your general practitioner and you know, not just, I mean, my wife's frustrations with it for women, it's even worse, I think.
Right.
And then, you know, it's such a common thing and it's just not dealt with. I appreciate, you know, everything you've taught me about it and the amount of help that I've received over the years from it. And I'm sure Janet appreciates it as well, because I'm not nearly as irritable, and I don't hurt as much, and you know, I'm able to recover faster, and learning about the optimization of it versus just accepting, oh, that's normal. Otherwise, I would have thought, you know, 350 would have been my goal,
right?
But I still didn't feel good.
Yeah, and that's the thing, Don. If men and women, who we're talking about menopause today, right?
Yeah.
If men want to feel better, have better cholesterol numbers, have better blood pressure, better sex lives, better attitudes, better muscle building, better fat burning abilities,
better cognition.
This is the hormone that does that for us. And so it's really important for men to get their levels checked, and not just a total, but a free, FREE, testosterone, and get it optimized between 35 and 60 and see what happens. Every marker of health will improve, and they'll know it just like you and I do when we're using it.
Oh, absolutely. And I'm grateful for, you know, your guidance and help with all of that.
Awesome. Don, thank you so much for coming in early on a Sunday morning.
I'm sitting here shivering because I just got out of the cold plunge before I came in.
You
here.
do the cold plunge 5 or 6 days a week, I understand.
Well, I do what I can.
Yeah, it makes me wonder about you when you voluntarily get in cold water. No, I'm kidding. I know how good it is for you.
Yeah, it doesn't feel good.
All right. Thanks, guys. Ladies, I hope everybody enjoyed it, and click in next week.
Take care, everybody.
See
Thanks.
ya. Bye.